Hello, everyone, and welcome to today's Open Minds Circle Elite Executive Roundtable, Lessons from the Field, the EHN Mass Casualty Behavioral Health Response Framework. I'm Stacy Fox with the Open Minds Market Intelligence team, and I'd like to introduce you to Kristen Daugherty, Chief Executive Officer of Emergence Health Network. Emergence Health Network is the designated local mental health authority and Local Intellectual Developmental Disabilities Authority in El Paso County, Texas, providing trauma-informed care centered around the needs of individuals with intellectual and developmental disabilities, behavioral health, and or substance use treatments. Christy has over 20 years of experience in the behavioral health arena and is a licensed clinical social work supervisor in the state of Texas and a licensed independent social work supervisor in the state of New Mexico. As CEO, she is responsible for all clinical and oversight services delegated through the performance contracts with Texas Health and Human Services, as well as a full array of behavioral health services. She has spearheaded initiatives that has significantly increased scope of service, added key components to the system of care, improved financial indicators, enhanced quality measures, and focus on patient data analytics to improve overall health. She has led efforts to form critical community collaborations that have resulted in expanding access points to behavioral health services and expansion of services, including partnerships with local school districts, the hospital district, law enforcement, and local housing authority. Today's session is moderated by Joe Naughton-Travers, an Open Minds senior associate with more than 30 years of experience in the health and human service field. He brings a broad range of experiences in private and public sector delivery of behavioral health and social services. During his career, he has served as a behavioral health clinician, a senior manager for a psychiatric hospital system and its community mental health clinics, and was vice president of a firm specializing in information systems and billing and receivables management for community-based mental health programs. As an Open Minds senior associate, Joe has developed business solutions for provider and professional organizations, state and county government, technology companies, and venture capital firms. His primary areas of expertise include strategic planning and metrics-based management, electronic health record and technology selection and implementation, operations improvement, and corporate compliance. Before we get started today, a few housekeeping reminders. Your audio will be muted during today's briefing. However, we encourage you to submit questions using the question box on the right side of your screen. We will present those questions at the end. The slides and recording from today's briefing will be available on the Open Minds website tomorrow. Joe, I will turn it over to you.
Thank you, Sarah. Hey, Christy, great to see you.
Hey, Joe, thanks for having me. Great to see you.
Yeah, well, I was thinking if you and I keep working in the field, our introductions will take 10 minutes or so, won't they?
Right.
Excuse me. Well, listen, thank you so much, both personally and on behalf of Monica and our elite members for joining me today. As you know, you and I have talked about this a number of times over the last year, the extraordinary experience you and your team have in El Paso are related to the Walmart shootings that took place about 3 years ago. And so as you share information with our audience today, I think about it myself in two ways. One is the very straightforward, here's how you help prepare for this kind of emergency, this mass casualty response. What should your organization be doing? How do you partner for that and be prepared and manage that sort of stuff? And I know you guys did all that well, and you'll share your expertise. But the second thing I've been thinking about, and I know you and I have spoken about this before, is this is different than other kinds of disasters in the sense that you and your team actually lived in it also. This wasn't, going to a place where a school shooting had happened or other sorts of things like that. You actually live in the community where all this happened, and it impacted folks you know as well as staff members. And so I think that brings a whole different sense to it. It's not just you know, moving through and doing the right emergency response, but it's also managing your own staff and your own feelings and all those families.
Absolutely. It's a professional response and a personal response, and you have to remember that as you're going through this and you have staff going through this, they're wanting to help as many people as they can, but you also have to help the helpers. And I think that's an important piece of what we learned as we went through this experience.
Yes. Well, listen, I'm going to try to pull up my slides for you here. And I will go ahead and get started here.
Great.
So for our audience members, keep in mind you'll have access to the video of this as well as the slides that Christy has put together for us. We have included that detail bio of Christy and her work experience here. And Christy, I'm going to sort of move through the slides and ask you questions along the way. So if I move too fast, just yell at me and let me know if you need me to move more quickly. So let's go ahead and get started.
Sure. So really looking at, you know, a mass casualty response, you know, many of my colleagues throughout the nation have had this experience, but also, you know, you look at natural disaster responses, and there's similarities, but there's differences as well. So we really are looking at when it's a man-made type of mass casualty. In our situation, you know, we were better prepared than we realized we were. And one of the things we wanted to share today was really making sure as an organization, taking a look at your statutory responsibilities. If you are a community center, and like in Texas, the local mental health authorities do have some statutory responsibilities. And sometimes people, organizations really aren't aware of that until they're in the middle of that crisis. So it's really important to look at those ahead of time, knowing what your statutory responsibilities are. In Texas, there is a responsibility for the local mental health authority when it comes to disaster preparation. And then another thing that we had done ahead of time is there was a lot of work done locally with our 911 and Office of Emergency Management. And so we did have a seat in our Office of Emergency Management Command Center ahead of this particular situation. We had participated in drills. And so one of the things we found after we had our incident, as we started talking to some colleagues in the nation, in Las Vegas and different areas, is that our community had put behavioral health in the forefront of the response, where some communities it was an afterthought. So the fact that our local community had already put that pre-thought into place as far as behavioral health being a key component of any sort of response to a disaster. And one of the big things that I'm very proud of that we had done in March of 2018, we actually authored the behavioral health chapter of our community's disaster response plan, which had outlined some of the steps that needed to be taken in the event there was a disaster, whether it be a natural disaster or a man-made disaster, such as the one we responded to on August 3rd.
Well, that's interesting, Christy, because of your statutory obligations there in Texas, you were required to do preparation for this, you know, for a disaster, you know, and had already created the relationship with the command center and actually even been involved in the formal planning. You know, I think sometimes we'll have other community mental health centers who end up just being a respondent in the community and won't have had these things in place in terms of they may not have been required to be the you know, the entity that responds to disaster, or they may not have set up. I think this liaison thing is particularly important because you already had a communication set up in case of disaster. When you talk to other colleagues around the country, is Texas different in this front, or is it just vary a little bit?
Well, I think it varies a little bit based on your state laws and statutes. But I think what it is that statutory obligation is really a response obligation, not a preparedness obligation. And so what has happened is when something happens, you are the response mechanism. So what we took that as is let's be prepared. So we took it as let's get things in place to where in the event we have to respond, it's not a reactive response. We have things already outlined and prepared, and I'll go into that a little more in detail as I describe our response, but it really did help us organize things very quickly rather than it being a more chaotic as we were responding.
Sure. So there was a plan, and much like fire drills, you practiced.
Correct. Yes.
In terms of being ready for it.
Yes. So a little bit about our actual event. So on August 3rd, 2019, at approximately 10:30 in the morning, an armed gunman walked into one of our busiest Walmarts here in El Paso. He killed 23 individuals ranging from the age of 15 years old to 90 years old, injuring 24 others. And actually a 24th, an individual died about a year later from his injuries. It was the 7th deadliest shooting in US history. And one of the things that we are dealing with as a community is the shooter did survive. He is in our jail here in El Paso. And as the community center here in El Paso, we provide all of the behavioral health supports in our jail. So not only are we supporting our community through this, the recovery from this incident, we're also providing care to the individual who, the person who attacked our community. It's very difficult at times. He was not from our area. He actually traveled to our area to specifically target Hispanics. There was a manifesto that was released on social media where he declared a racially motivated attack. It was the Walmart that he selected was very strategic. It is a Walmart that is very close to one of our very busy border crossings from Mexico. It happened to be on a Saturday right before school started, where folks were school supply shopping. There was a lot of activity. It is attached to it's in an area close to a very busy mall as well. So I can tell you that it took the ripple effect of this particular attack it was the layers that it took, the toll that it took on our community, on our young children afraid to go to school in the next weeks because of the color of their skin. There was a lot of work that had to be done to create a safe environment for our children and our community. So really, I think you went a little, there we go. So one of the things I can tell you that back to that preparedness is the foundational supports and relationships that we already had in place. I can remember vividly where I was when the text message came in from the police chief. And yes, as the CEO of the local mental health authority, the police chief has my cell phone number. And I got a text message saying, Christy, we need you and we need you now. And so that relationship was so critical because one, he knew how to get a hold of me on a Saturday morning. And two, he knew to get a hold of me because they knew they needed us. And so that's so important. And if you look at this picture, this is an actual picture of the Office of Emergency Management Command Center that Saturday of what was happening and all the people responding and the different mechanisms moving. We had the fire department were depending on us. I can tell you we have what's called a crisis intervention team where we have clinicians ride along with officers to respond to mental health crisis or psychiatric crisis in our community. 2 of our CIT teams were in the parking lot. They were, because it was all hands on deck. So they responded into that parking lot that morning. And so we had 2 staff members that were part of that response. And I spoke with one of our clinicians and her story to me when she said her law enforcement partner turned to her, threw the keys to the patrol unit to her as he was running and said, just in case I don't come back. And so that stuck with me. It was August in West Texas, so it was hot. It was a very hot day. And immediately that parking lot became a crime scene. So cars weren't allowed to leave. Shoppers weren't allowed to do anything with their groceries. You know, there was so many different things happening. And so we were able to get people there to start helping people get out of the area. Our Sun Metro, our busing, our transportation brought in buses just for air conditioning because it was so warm. We had staff positioned on those buses just debriefing with people for what they just saw. A local school was our first reunification center because people were wondering where their loved ones were. We had staff there. Again, it was those relationships that we had that were the trust. Really, it goes to trust that our law enforcement community knew to call, and they were trusting me and my folks to be able to get where we needed to go. I had folks in emergency rooms helping folks navigate that system. Myself, I was at the command center. I debriefed with about 50 firefighters that were in that parking lot that morning to make sure they knew who to call in case they started having issues. It was just, again, because of those relationships, the trust, we were able to orchestrate through the chaos and make sure behavioral health and mental well-being were a priority.
Sure. And what sticks out to me, Christy, as you described this sort of harrowing first day, is how important, one, the communication was, that it was already in place. You know, they knew to contact you. And then obviously you had some way to contact your entire team. Because you had a plan for how to get people where they needed to be, or you improvised really fastly, I'm not sure which. But you're describing, you know, within hours of this event happening, that you had people in multiple places, whether it be in the parking lot, whether it be in the, you know, the cooling buses, or the family reunification center, or the crisis area. So this is where, you know, just having an obligation to be a respondent in a disaster is not enough. We need to have these communication things in place, as well as a way to deploy quickly. You know, I mean, you deploy quickly almost like an ambulance would to a medical emergency.
Yeah, it is. And it was about coordination. I can tell you, when I arrived at the command center, I spoke directly with the fire chief that was the head of the Office of Emergency Management. We had a quick conversation, got on the same page, and he immediately gave a directive that all, you know, mental health, behavioral health requests, because of course everybody wants to help. There were a lot of folks coming out to help, and coordinating volunteers is a full-time job when this starts happening. And everybody's intentions are good, but it could turn into more chaos as that happens. And his direction was, if they don't have an Emergence Health Network badge, they're not coming in this first 24 to 48 hours, which again goes to the trust and the relationships that we had. We issued very specific phone numbers for them to call when they needed something. So that coordination at my level to my people. And then, like you said, we had that phone tree, the coordination of who was going to go where, and everybody knew what their role was, and there wasn't confusion or questions. Everybody just knew exactly what they needed to do and where they needed to go.
Sure. And literally, what was the communication for you and your team? I mean, was it text or phone calls? I mean, or did you have something set up in advance that's sort of like, this is the disaster and here's what we're doing? I mean, how did you approach that? I mean, it's just hard to imagine simple things like that needed to occur quickly.
Initially, it was group text. I mean, that was the easiest thing to do, is communicate through a group text because everybody got the same message. Some phone calls, but really the group texting on a Saturday morning was the easiest thing to do. And then I immediately started communicating with CEOs of hospital systems and things like that through just phone calls and text messaging, because we were all, you know, managing different fielding calls and fielding different inquiries coming in. And so it was just basic text messaging that I think saved the day for us. And we were able to get the consistent message out, where I was giving it to my executive team and they were quickly pushing it out to their folks.
Sure, and I think what's important for our audience to understand, if they've not been directly involved in this sort of emergency response, is all of you guys, your team as well as your community partners, were communicating at a time when the facts were still coming out. I mean, it wasn't, it wasn't clear completely what had happened or how many injuries there were or other sorts of things, or whether the shooter had been caught yet early on. So you were also working in a time period where you were also getting up-to-date information, and I'm sure that that made it challenging also.
It did. And one of the things that we had to also coordinate is when that individual was going to be received at our jail, because an assessment had to be done and things like that had to be done. So we were not only coordinating a community response, we were also having to prepare to receive this individual in our detention center. So there was a lot of different wheels moving at the same time. So yes, there were lots of information, and again, the community came together really trying to help, and it was, at times I was the bad guy because I did have to turn people away, because in that first 24 to 48 hours there was a very specific need that that we had to address, and we had to make sure that the individuals responding to that need were properly trained. And it wasn't basic therapy, and not everybody is trained in crisis response, and I knew on my team who was trained. And so we thanked people, we told them we would contact them when we needed, if and when we needed help. And so that was difficult, but I took those hits, and we made sure we got the right people in the right places, because you could do more harm if you don't have people trained, you don't have individuals trained in the right modalities to address some of this immediate response.
Yeah, it sounds like a delicate balance, because certainly I'm sure that there were lots and lots of the people in the community that wanted to do something to help. So
absolutely, yeah, they were, and it's great. I mean, again, our community came together, we wrapped our arms around each other, but you also have to be very careful not to do more harm. And so that's where we talk about clinical intervention models. We were very, again, careful and selective on who responded to what. So community outreach and messaging immediately. We have a crisis hotline, so that was blasted out everywhere. We made sure that that was available to everybody as quick as we possibly could. We formed some strategic partnerships with folks. One of the challenges I had that was very unique, again, I keep going back to the shooter being booked into our jail, is my chief medical officer. So we were very strategic on who received that individual at the jail. I did not want my basic frontline staff booking him and assessing him into the jail. That was too much for that person. So I had one of my executive staff at the jail at 3 o'clock in the morning when he was finally booked, do his assessment, and my chief medical officer actually did his evaluation as he came in. So when you do that, those people are then basically they're off. The media has no access to those two people now. So I have a lot of media requests, as you see in the photo. Lots of media requests. Everybody wants to talk to the psychiatrist. Everybody wants to talk to clinical folks. So I was so lucky that I had a community psychiatrist. He was one of the first people to call me and say, Christy, what can I do? So I partnered with one of my community psychiatrists. He was the face. He came out. He did media interviews, and that's not something you think about, because once your staff has either been in contact with the shooter or been in contact with any perpetrator, you don't want them in front of the cameras. And that's something in your planning you need to think about. Who's going to do media requests? Who's going to do interviews? Who's going to talk to certain folks? And so we quickly, I knew who I trusted. I knew who I could put in front of cameras, and we were able to do that. And Dr. Vanderpool was so wonderful. He came in and he quickly stepped into that role and took on those media interviews with me. And because that messaging is so important to make sure you're getting that right message out about help. Internal communication, making sure my staff was, because we still had to run a community mental health center. We still had to make sure all of our operation was still running. Clinics were still running. Medication was still being dispensed. Everybody was still being served. And I didn't want to exhaust my staff. So this was in the first 24 to 48 hours before. I can tell you, I had several of my peers in Texas call me, and they came through, and we had respite teams coming in within 3 days because they had to speak Spanish. We had to have the right respite teams coming in. And so I had to make sure my staff was okay. We were still running our operation until our respite teams got there. And then helping the community, making sure our law enforcement were taken care of, the Walmart staff. We couldn't forget about those folks at the Walmart and the Sam's that were affected. So after the first 24 hours or 48 hours or so, our convention center turned into a recovery center. And we had folks that were bandaged and had been part of this incident coming to this recovery center asking, hey, I don't know what to do. My car is still in the parking lot. How do I get my car? And as the local mental health authority, I'm thinking, I don't know, but I'm going to find out. We're going to figure that out for them.
Yeah.
So we were answering questions we were not used to answering. And we figured it out because I never wanted to tell somebody I don't know or no.
Oops, I may have jumped a slide there again. Apologies.
So really the big thing as you go through this is you have your immediate response, which I've talked a lot about. Then you have an intermediate response, which is about, a week or two, and then long-term, which we're still in. We're still in that recovery. And so as you go through this, you have to be ready for that long haul. It is definitely a marathon and not a sprint. And so looking at the immediate response, as I shared with you, we had our CIT on site. I had to make sure those folks were okay. We had to talk with those, tracking patients. Where are people? Helping family members find their loved ones. Again, my crisis line, it was being called by folks asking how to get their car, asking where their loved one was. One of the hardest things I think one of my staff members shared with me was they were at the reunification center and somebody came in and said, I just did find my iPhone on my loved one and it's saying it's still in the Walmart. Why is it still in the Walmart? Well, that was a active crime scene for several days. We didn't know if there were still deceased people in the Walmart. We didn't know. And so we were having to try to walk through this with people. And these are things, you really never thought you would have to work through with people. So you have to be ready to deal with things you just really never thought you had. And my staff, they worked through, they would sit down with individuals and just they needed to spend 10 minutes or they needed to spend 2 hours. You got to be ready to do that. Again, deployment of clinical teams. We deployed people all over the community. One of the things that I can tell you that was really something I never thought I would do is the medical examiner's office. In El Paso, they may do 25 autopsies a year with regards to gun violence or murder. They did 23 in a week. And so by the end of that first couple of days, they were on their knees. And so we did luckily have some, they call them crisis response intervention teams, CERT teams came in with therapy dogs. We did have the therapy dogs here. I was able to secure them an office space. So you got to find space for people that are coming in to help. We did that. Had to get the therapy dogs to the medical examiner's office. I'm getting these calls and again, you don't want to tell people no. So you have to get very innovative, but we had to take care of our medical examiner's office. Volunteer management. I can tell you that is something that was a full-time job, is really trying to embrace the help, but coordinate the help to where you didn't do more damage. My crisis team and several of my CIT team members, they went out with the district attorney's office, victim assistance. They did death notifications. We went out with the victim assistance program and provided that support on porches when they were giving death notifications. It's something you needed to be ready to do and understand that process. And then really that community messaging. One thing we did within 24 hours, we stood up this counseling co-op and we had them throughout the city at different times of the day. We provided snacks and it was just, I had a therapist sitting in a room available. And sometimes we had one person show up, sometimes we had 10 people show up, but we were there and we made sure that we had that advertised everywhere and we were available to people to just talk to, because the big thing we had survivor's guilt. A lot of people saying, you know what, I was supposed to go to that Walmart that morning and I decided to go get a haircut first. I was supposed to be there. You know, and then the big thing on the racial issues is why Hispanic people, why El Paso, why did they come after us? So there's a lot of whys that there weren't answers for. So we were available for folks for that whole first week.
Sure.
So in the intermediate, we came together very quickly. I can tell you our governor was very generous. He came in within the first couple of days. I sat down with him and I remember his ask. He looked at me, he said, Christy, what do you need? And I said, sir, back 6 months ago, I put in a grant to your office for a crisis response grant. I need that money. And he got it to us. And I know it was unfortunate the way we got it, but we were able to put out a wonderful campaign. So you really got to think about messaging. And so what we did is we put together coordination with our state disaster services. We came up with El Paso Strong. We really talked about encouraging people to talk to someone to get help. El Paso came together so tightly around this. Mainly, I really think around the culture and the fact about it being a racially driven attack. So we wanted to go out and talk to people and make sure people had an outlet. And so I talked about the counseling co-op. We had so many people came together, churches, civic groups. We all came together and we wanted to make sure that we were able to communicate. And we led that effort as the local mental health authority on making sure we talked about helping is healing and making sure people had an opportunity to heal. We were available at memorials. If a family wanted us there, we were there off to the side. We were at funeral, whatever people wanted us, we were there. We also had a seat on the charity fund. There was a lot of money that was coming in and they were giving it out to families and survivors. And we actually had one of our executives was able to sit on that fund, and we were able to help determine who were able to receive those funds. So being able to put yourself out there as an organization and make sure you're engaged beyond your four walls as far as a behavioral health organization, making sure you're reaching out to the civic groups. Hey, where can we help? What can we do? Really doing things you're not used to doing. And it really has strengthened us as an organization, but strengthened our partnerships beyond this particular event.
Sure. And Christy, you may remember that I happened to be coming down to work with you and your team very shortly after this event, and you were already El Paso strong when I came down to visit. And it was I must say, as an outsider, it was really remarkable to see how the community had come together, and even what you have on your slide here, to be able to put together the materials to sort of brand this as strength means getting help. To get that done and to actually be able to respond to it in such a short period of time is pretty astonishing.
Yeah, our community, they're resilient, and I know we're going to show a couple of videos, and I can tell you this young man, I get a little choked up. This young man that you're going to see here, what we did is we just went out and asked. We had a great partnership with Barracuda Advertising Agency. They're a wonderful locally owned, women-owned agency, and Marina is the owner. She said, "I'm here, I'm helping. What do you need?" And they went out and just talked to people. And this video you're going to see of this young man, Dre, he was asked the question, and this was a one take answer of this young man speaking about how he felt and what this meant to him. And so I can tell you, I think he was like 10 or 11 years old at the time, and just hear how articulated he is, but how passionate he is about how it meant. And we talked to people all over the community, and then we put these out on social media and on TV, and it had such an impact in our community of people reaching out and getting help. So I hope we can show Dre and how it impacted him.
I think it's this video, so let me get it started for our audience here.
all these messages started flashing on the TV, our phones, and we were calling our family members to see like, oh, you guys okay? Like, we were just so worried about everybody else, not ourselves. But it was sad at the same time because there was innocent people that lost their lives for no reason at all. Get the right help, because if you just keep storing all those emotions away, it could turn to something bad. Strong means healing.
Amazing little kid.
Yeah, very. The only thing we asked him to say is strong means healing. Other than that, that was all him. And so we had several of those in English and in Spanish. And I can tell you, we put that together in probably about 10 days after the shooting. Those were out in the community. And I can tell you one thing we did intentionally, if you notice, Emergence Health Network, we did not put our name on any of this. We wanted this to be a community campaign. We didn't want it to be attached to the mental health authority. We really wanted it to be a carve out away from us. We wanted mental health first aid to be very, very prevalent on this because we wanted people to feel like, okay, I want to be part of this. But we designed this very strategically to be away from the mental health system and the behavioral health system. Because one thing, you've got law enforcement, you've got first responders. They are very, sometimes they're very hesitant to seek mental health services. They're hesitant to seek services because they could be seen as weak. And so we didn't want them, we set up a whole separate, you'll see here in a minute, a whole separate clinic that did not have our logo on it. It wasn't attached to us in any way because we wanted somebody to be able to just, if it was a police officer or a firefighter or anybody that was struggling, we wanted it to be a very safe place for them to walk in. And so that was very, very purposeful to not have our logo anywhere on this.
Sure, and I think we have another video here too.
Right, so this campaign was a little bit longer run. Those were PSAs that we ran throughout actually a full year. We ran these for a full year, and the purpose of these was about getting help. But if you'll notice, if you know anything, El Paso is again a very strong, a very proud Hispanic community. So we wanted to make sure when somebody was watching these PSAs, they could see themselves. So we made this very, very El Paso specific. So that's what you'll see that these PSAs portrayed.
Let me play it for our audience here.
Thank you.
Strong means healing.
Strong means helping. Strong means getting help.
Strong means reaching out.
And you said those ran for quite a while.
For about a year, yeah. We had several, English and Spanish, again, but it's a beautiful El Paso skyline, and our star on the mountain is something that we're very proud of. So we really wanted people to relate to those and reach out. Again, we did not put our logo on anything. We made it very specific to the El Paso Strong because everybody really came together around that. And so again, we had a community recovery center. That was our logo. We had it separate from all of our clinics. Again, we really wanted folks to be able to just walk in, get help, talk to someone, separate from Emergence. Everybody knows Emergence Health Network as the mental health system in El Paso. We are the biggest system in El Paso. So we did have our crisis line. We had billboards, we had our crisis line. We did push that because we wanted people to know our crisis line was still there. But we also had a whole separate campaign. And all of this, again, was done within about 10 days. And so between our partnership with our advertising agency, so if you don't have a good partnership with a great marketing firm, find one because they were priceless during this time. You may not think about it, but that could be part of your plan as you're putting together a response plan. Make sure you have a marketing firm that's ready to go. And then our media outlets were wonderful. They were pushing this stuff out for us. Really, we have some great media partners. Again, if you don't have good relationships with your local news channels, make sure you're starting to develop those. And then we did direct outreach to schools. So some of those videos that you saw, they were showing those in the schools. They were showing those on screens at basketball games or football games. And so that stuff was shown everywhere. And so everybody was really embracing those things, but it all went down to a relationship we had already built, having conversations with these entities ahead of time to where, one, they trusted us, two, they knew the material was going to be quality, and three, they knew if somebody called that 779-1800 number, they were going to get help. So it really is about that relationship again.
Sure, and it's also not only the relationships, but having the same sort of understanding of what the community needed and about, mental health issues, because just being able to frame things as recovery or first aid, as we know, makes it more approachable to folks. To be able to put together, the graphics and the campaign and all these materials so quickly means that those folks you were working with, whether they be, the TV stations, the marketing firm, needed to have an understanding of what we're talking about if they were able to turn it around so quickly with your help.
Yes, and so like I said, we work with them on stuff all the time. So we weren't new to them. Our concepts weren't new to them. Our services weren't new to them. That's what I'm saying. As you're developing your response plan, you think about all your clinical services, all the things you need to do, boots on the ground, but all of these kind of ancillary things, these folks need to know who you are. And they need to be comfortable with who you are. And we had all of those things in place to where we could, I think we had this community recovery center logo turned around in like the same day. Our firm that we use said, hey, what do you think? And we're like, it's brilliant, wonderful, we love it. So it really is about thinking outside the box a little bit to say, who are my partners and how comfortable are we with each other? Not just them with you, but you with them. And so there has to be, that you have to have that kind of that toolkit put together in the event of something that you need to turn around very quickly. I really would not want anybody to have to go through this, but in the event that you do, if you already have these things, these relationships and a lot of these things put together, it is helpful for your community to be able to push it out, because the sooner you can get it out, the more folks are going to be able to help.
So summarize for us here, both the lessons you've learned and your specific recommendations for our community mental health agencies and individuals out in our audience at this point.
Well, I think I've said it a lot during our time with today, Joe, is the relationships. I think that is so important, because anytime you're in something, anytime you're in a crisis, whether it's a personal crisis or as we were in a community crisis, trust is key. And our law enforcement partners trusted us, our community trusted us. And so we were able to really get things moving, and really, I think we helped so many people from the minute it happened. And again, talking to a lot of our colleagues that we've gotten to know in this world, that as mass casualty, behavioral health sometimes was an afterthought, and it shouldn't be. It needs to be in the forefront. So make sure you put yourself there in the forefront and build those relationships. One of the other thing that we found out that kind of falls between 1 and 2 is some folks didn't understand our purpose. So we are the local mental health authority, and that statutory responsibility that we have. There were people in the community that didn't understand that. And so one thing that we did do, we put together a little white paper after, a few months after the event, and we went out and started educating different groups on what our role is in the community, because we found out during our response to 8-3, folks didn't know who we were other than a provider. They didn't know about our statutory responsibilities. So we took that as an opportunity to teach and educate. And so that was important. Make sure you know you're really partnered and tried to have a seat with your Office of Emergency Management. Again, they have a public safety responsibility, but they also they need to put behavioral health at the forefront. And fast forwarding a few months after our shooting in August of 2019, here we are in a pandemic. Office of Emergency Management is handling that here in El Paso. We were one of their first calls about a behavioral health response to the pandemic. So it really does help your community to have that connection with your emergency management. I can say if I had it to do over again, I would have a full-time FTE designated to volunteer management. It was difficult. We had people coming in for all over the nation, and we limped through that piece. I can tell you, that wasn't our strength, but we managed it. We got a little better each day, but it's a full-time job, and you want to be gracious and you want to be thankful, but you also want to be strategic and you want to make sure you do that right. Your staff, you have to make sure, because they don't want to stop. They don't want to give up. They want to keep going. And I am so grateful for my partners, centers throughout Texas that sent in respite teams. And I can tell you, one of the things we did, we were very organized in how those respite teams came in. I had staff greet them at the airport, bring them to our center. They were briefed. There was a briefing of that, an outgoing briefing of the center, the team that left, an ingoing briefing of the team that came in. We were very, very strategic on how we brought those teams in and out to where, things didn't get dropped, and we wanted to make sure that we didn't leave them hanging. We wanted, like, again, we picked them up at the airport, we brought them in, or if they rented cars, we still greeted them at the airport to make sure they knew what was going on. Just little small details like that made a huge, huge difference in the streamline of how those teams came in and out. And sometimes you have to force your staff to go home and tell them you are going to go home. And they did great stuff, but they didn't want to. They looked exhausted, and we had to make them go home. And then the recovery, as far as long term, it is, you got to prepare. You get past the initial shock, then you get into funerals. You got to get through the funerals, then you get into anniversaries. We're still waiting for a trial. It just got pushed again. I think we're now looking at 2025. So we're dealing with that. So there's a lot of pieces you got to be ready for beyond the initial couple of weeks of shock. And so it is a long-term recovery process, and your community will never quite be the same.
Well, sure. It's, what we talk about in our industry is that, it's trauma. It's trauma for the community, for the individuals, and the impact of that over time. And it's only been, it'll be what, 3 years this August, if I remember correctly. In some instances, people's reactions may be delayed also. So I'm sure you've also been dealing with that at points where individuals are responding later in time rather than immediately after the event.
Right. Yep, that is true. And then again, once the trial begins, I think we'll go through a whole new set of trauma factors.
Yeah, it'll sort of revisit everything again. I'm going to turn off the PowerPoint here in a minute. I did just want to mention before we get to some questions and discussion that we do have our next event is the Hillsides Cares case study that'll be happening on March 17th. So you can find more about that on our website. Let me turn off my screen sharing so I can see you again, Christy. For those in the audience, while I'm presenting, I actually can't see. So hopefully I was behaving while you were presenting there. Thank you so much for what you've shared so far. I'm curious about what your thoughts, because you and your team have lived through it. And you did briefly mention that the COVID pandemic happened sort of immediately after this, but I think it's important to point that out. So your community has been, wrestling with disasters essentially for several years now. A term I'm hearing a whole lot now is called compassion fatigue. This notion of, as helpers, of just being burnt out or not recognizing it, or just not being able to continue doing the work we've been doing. I mean, what are your thoughts on that? Does that apply some to your community, or even to folks who are working in agencies like yours?
I think I think COVID has taken a toll definitely on our industry, on healthcare as a whole. I have nurse friends that are they just are tired. I just can't even imagine what they've been through working in hospitals. With this particular incident, I think it happened and it was so fast, and then it was kind of like we were in shock, And then it was like we went into the like, it's almost like the cycle of grief. When you're going through the grief and loss cycle, we were going through the anger, and then, you know, we all were going through that together. And then we hit COVID, and it was almost like we were all just going through it again. And so I don't know if it's compassion fatigue with us as more as it what's next. You know, I think that's where we're at. We're just, my staff, I have wonderful staff, and you know, they, like, my crisis team worked through pandemic. They never were ever remote, and they're amazing, and they're the same ones that responded to this shooting. I think they're all just kind of with their eyes really big, thinking what's next.
Well, hopefully, you know? Nothing next is for El Paso.
Yeah. I talk to my staff as often as I can, especially my crisis team, and they're so passionate. They're so passionate about what they do, and they love what they do. I don't see the compassion fatigue as much as I think they're just kind of waiting for the next shoe to drop.
Sure. Yeah, and I haven't had the experience you and your team have, but to me, the front parts seem to be more tolerable because they're so focused on getting tasks done. You know, there's so many logistics and things that need to happen. I would be afraid of the pause after that, when things sort of start to sink in. You know, when you're no longer getting the therapy dogs in your own car down to the fire station and doing all the other things, when you pause, that's when you really have a chance to reflect on what's going on.
Yeah. Funny, real quick, therapy dog story. So we actually, I told you, I actually had to, I secured office space for the teams that were coming in from the different Texas areas with the dogs, and the folks that help first responders, and we got them office space here near our offices. And one morning they came through our offices with the dogs, you know, and I'm good. I kept telling myself every morning during the first, you know, 4 or 5 days after this incident, I'm good. I was telling myself that every morning. I got up, I look in the mirror, I'm good. Well, I'm standing there, and the dog comes up to me, and you don't really, I guess you don't really I didn't understand the therapy dog. They're beautiful, they're sweet, I love animals. So I squatted down with her to pet her, and she leaned on me, and it's just this, it's almost like they're just sucking out this, I didn't realize. And I got down on my hand, like on the floor, and it just was so emotional with this dog. And I thought, oh my gosh, I felt like I owed her like a kidney or something, because she took so much away from me, and I wasn't good. And I think that's what she was trying to tell me, is you're not okay. Take a minute. Take a minute. And I had to come in my office and shut the door for a minute, because the emotion that dog brought to the surface. And I think we all need to realize that we're not good. And for that beautiful animal to tell me you're not okay was pretty empowering. It was pretty powerful.
Wow.
So, it's a therapy dog story.
So as you said several times, the thing that stick out to me in terms of preparedness for these kinds of disasters is having a plan. You guys actually had a plan before you needed to address this particular incident. The communication piece obviously was really important. And then you really stressed, I think, the notion of all the partnerships were in place. So you already had relationships with police and emergency services and other, you know, healthcare facilities, with your marketing firm and other sorts of things. So you could rely on those. You didn't have to find those. And that's the part that, you know, it's not just writing a disaster manual. You know, and many of us are doing that. You know, many of us have things in our accreditation guidelines or other sorts of things that are disaster preparedness or a disaster plan. But that's very different than having the things in place.
Right. And the people you can pick up the phone and call, and having I think it's the relationships and the trust. The big thing here is the trust. They've got those law enforcement agencies have to trust you, because behavioral health isn't on the front of their minds. So when there's not a crisis, that's when you need to build that trust, because when there's a crisis, they don't have time for that.
Sure, and that kind of trust building isn't something that happens in a meeting or two. That's something that you build over time with those community partners. And I think that's one of the important lessons for our audience, is that you have to work on these things and have them in place, as well as the more widgety detailed plan. But building that kind of relationship is not something that is, you know, going to an event once a year or visiting the police office or something.
That's right. And then taking if you want to look at the media side, we have those relationships built with our media outlets. When we called a press conference, they all came. We called a behavioral health, you know, response to this situation press conference, and all of our media outlets showed up. That's huge. And I think you have to build that ahead of time too.
Sure. Well, we only have a couple of minutes left, Christy. Did you have any final thoughts that you wanted to share with our audience in terms of being prepared and being able to help the community, their community, the way that you have helped El Paso?
My final thought is, you know, you're never 100% prepared. I can tell you that. I believe, you know, just talking about it is important. Always having the conversation in the forefront. Working on those relationships in time of calm is critical. And, you know, reaching out to colleagues. You know, we've already talked with colleagues throughout the state. We're happy to have conversations with colleagues in other states. You don't have to reinvent the wheel. There's many of us that have unfortunately been through this. And so talk to your colleagues and start working out your plans now to where you aren't overwhelmed in the event something happens.
Sure. Well, listen, I'm going to bring my colleague on here as we wrap things up, but I wanted to thank you both for the content that you're sharing with our audience, but also for being part of El Paso Strong. I look forward to coming down and seeing you all in a couple of weeks.
Well, I want to thank you for being part of El Paso Strong, Joe, because you were one of the first persons that reached out to me that day, and you are part of our community and have been so wonderful to us for many years. So thank you for being part of El Paso as well.
Well, Christy, I will say thank you. Joe, thank you for bringing Christy and her story to our audience. I'm glad I was not on camera, because I will tell you that I did shed a few tears listening to someone who was there and walked through it. It's just, you are stronger than strong, all of you in your community. I want to thank you both for delivering the presentation. For the audience, the slides and recordings will be available tomorrow on the Open Minds website. The Full Circle Executive Roundtable Series is available on demand in our Open Minds library. And as Joe mentioned, we do invite you to join us for our next roundtable on Thursday, March 17th at 1 p.m. For Hillside's Cares, Case Study, Service Expansion, Health Plan Contracting, and Strategic Repositioning for California's Evolving Value-Based Market. During the session, Garrett Zabel and Lucy Garcia of Hillside's Cares of South Pasadena, California, will discuss their strategy and journey as a nonprofit children's service provider in Los Angeles County to enter the health plan managed care market. For a full list of upcoming roundtables or to register for the March 17th event, please visit the Executive Roundtables under the Events tab at openminds.com. Again, thank you both.
Thank you. Be well, everyone. Thank you, Christy and Sarah.